Hello, my name is Sydney Sears, and I'll be showing you guys how to insert and remove a Foley catheter on a male patient. So before I do that, I will perform hand hygiene, and I will provide privacy, make sure privacy is available, and also I will get 2 patient identifiers from the patient after I introduce myself. So hello, my name is Sydney, and I'll be your nurse for today. Can I get your name and date of birth? So-and-so, and then I will match that with his ID band. All right, Mr. Livingston, okay, how are you today? And you explain to me, then I'll ask the last time he voided, and if he had any difficulties, which he's had, and that's why he's receiving this catheter. So before I start, I will perform peritoneal care to make sure everything's clean. So I'm gonna raise the bed to my waist level for good body mechanics. Okay, and now I'm gonna pull back this cover, and I'll let the patient know to let me know if he feels any type of discomfort. Okay, now I put him into position to where I can easily perform peritoneal care. Okay, I will put my gloves on. The supplies you need are wipes and a towel to dry. Okay, so you'll just wipe the area. Make sure ask the patient if he's doing okay. How are you doing? Okay, he's okay. Next, I'm going to dry the area. Okay, and peritoneal care is complete. So now I will remove my glove and I will set up my sterile field. Make sure all this is dry. Okay. And this will be my little trash can for anything I need to throw away. And I'll let the patient know that it's up under the bed so he doesn't, knock it off or anything. Okay, so now I will start and set up. All right, now I will put on my sterile gloves. Okay, dominant hand. Alrighty, so now I'm going to place the drapes, correct draping. This is the barrier you want to put underneath your patient. Make sure I don't touch anything. Okay, next, this is the next you put around your patient's area. Okay, we'll fix that later. Okay, so now you want to open up and set up. So these are your iodine swab sticks. So we won't actually use this on the actual mannequin. So I would pour iodine on the swab sticks. And before I do that, I'll make sure the patient is not allergic to any iodine or latex. So after I do that, I would open my lubricant. And set that up. Okay, so before you do that, you want to test the balloon of the catheter. So I will open my syringe stick. And mainly the syringe stick would include 10 cc's. So we'll just test the balloon. And there we go. The balloon's working fine. And now we would excrete all that. Okay, so now we know that the balloon is working fine. So I will leave this syringe inside the tube, and now I'm gonna lubricate the catheter. Okay, so I will leave that in there. And with my swab sticks, I'm gonna wipe down the perineal area. Okay, so the first one you want to do, after I hold this. Okay, so now I'm going to use one hand to where it's going to become non-sterile. So which is my dominant hand. So I'm going to wipe the outer area. And then the second most outer area. And then the tip. Okay, now that we did all that, it is now time to insert the catheter. Okay, so I will ask my patient to take a deep breath, and then I'm going to insert once he exhales. So please take a deep breath, Mr. Livingston, and then exhale. And then you slowly just insert the catheter. And you want to do this for 6 inches deep. Okay. So now that I'm in, I'm going to pull in the 10 cc's to blow up the balloon. Are you feeling okay, Mr. Livingston? Okay, good. All right, now that the 10 cc's are inside the balloon, I'm gonna pull onto the balloon. I'm gonna pull onto the catheter and to see if I can meet resistance, which I have, meaning that the catheter is correctly placed inside. So what you want to do is you want to untangle the rest of the part of the catheter, and either you're going to place this on the patient's inside of the leg and tape it, or you can place the catheter on the side of the bed. So now I'm going to date and name the catheter. I'm going to put that, document what I see, and that's it. I remove my sterile gloves, and then I'll wash my hands, and then that's how you insert a Foley catheter.